Hey guys, Nick here. Thanks for coming by. Listen, I just wanted to do a quick little video for a couple of minutes and just talk about some stuff that you really need to do when you have any kind of diagnosis, whether it be cirrhosis, cancer, or anything else. You really got to be an advocate for yourself. If you've got a scheduled appointment in a doctor's office or in the hospital or whatever, healthcare providers are busy, and, they've got a bunch of patients, but if you're really an advocate for yourself, and just really, don't let people off the hook, if you've got a question, ask it. If you don't feel like you're getting the proper amount of care or proper amount of time, with your physician, find another one. There's, a lot of things, that you can do by doing research and being well prepared for an appointment when you come in. One of the things that I like to do is have a list of questions written out that you want to ask them. It's really easy if you're seeing a physician, you get nervous, because they're always in a hurry, or something, and it gets you in a hurry, and sometimes you forget things like, oh damn, I wish I'd asked this when I was there, and it really goes into just being prepared, and being invested, in your own diagnosis, and being invested in your own care. Make sure they know that you're taking the medications that they prescribe. Make sure they know that that you're going on walks, or that you're exercising, or that you're really taking a part in your own health. And you would be amazed at how far that goes with a physician. And when believe it or not, these physicians, they do talk to each other. And if you're getting a referral, ask for the notes from the previous physician that you can bring to your GI or to your nephrologist, so that they can see, hey, these are the blood results that we had, for example, at their last appointment. And they may take some blood work, when you're at that specific physician's office, and then compare and contrast. They will work with you if you work with them, but you really, really have to be strong, and you really, really have to let them know that, hey, I'm taking this seriously. I want you to take this seriously. Don't just be a number. Make sure that they know your name, and not just your last name or your patient number or your patient ID. Make sure they know your first name. If you're not good at communicating, hourly like that, bring someone with you. A lot of times, if you have a friend or a caretaker or a spouse, it's easier to talk in front of them because you feel like, it's someone that has your back. And, believe it or not, the doctors, they can get a little bit not intimidated, but they can be brought to a little bit more attention too. It's like, hey, I've got someone else watching me. This is a group effort. This is a team effort. It's not just one individual, coming, to me, for their scheduled appointment. This person is bringing somebody in to have their back. You'd be amazed at, just how little things like that can really kind of bring, the physicians and the nurses to attention. You heard me talk about nurses. Make sure that you're in really, really good with the nurses. Be polite. The nurses talk to the physicians before, during, and after you're gone. You may not think that they do, but trust me, they do. They're checking your disposition. They're checking, how involved you are when the nurse is doing the screening and things like that when you come in. Before your appointment, when they're taking your weight, make conversation with them. Make sure you're giving them as much detailed information as you possibly can before the physician even comes in. Have a list of all your medications. Know what you're taking. Know when you're taking it. How often you're taking it. Guys, little things like this show healthcare providers that you really are invested in, your care, and you're invested in your own health, and that you want to live. Guys, it's your life. You only get one, so you got to fight for it. Don't fall victim to the white coat syndrome. Make sure that you have your own white coat. Wear a white suit if you want to. Wear a white T-shirt. Do anything that makes you feel comfortable when you go into these appointments. And guys, I'm telling you, it's going to work wonders. It will make a difference in your health. It will make you feel better. And when you feel better, when you're in a good mental place, your body will respond. I promise you, your body will respond. It may take a while, but it will. Guys, I appreciate you coming by and spending some time with me. This channel is really taking off, and it's so rewarding and so cathartic for me. Guys, I love all of you. Remember to hit that like and subscribe button at the bottom. Guys, it really would help me out as I'm, kind of getting back into the flow. I had to take a mental health break, but I'm jumping back in. I'm jumping back in slowly, not with both feet quite just yet, but tiptoeing into the pool, and eventually I'll get right back in the deep end. So guys, sorry if my eyes are a little bit off. It looks like I'm recording this on my phone. I'm not at home right now, so I don't have my normal setup. But guys, I really appreciate you spending some time with me, and I hope you guys have a great week. Yesterday was Easter, so that means spring is coming, and spring is here. It's pretty, it's beautiful outside. Enjoy the day. Guys, I'll talk to you later.